You might think that the dental chair is just about teeth, but what if it's also a front row seat to early warning signs of substance abuse? Today's guest is turning her clinical role into a powerful tool for advocacy, awareness, and change. Stick around because you're going to be surprised by the connections between sobriety and health.
Welcome to the Sober Life Rocks podcast. You may have made the decision not to drink alcohol, or at the very least, not at work-related events. Whether you've never been a drinker, are in recovery, or made a health-related decision, we see you, and you are not alone. In today's world, networking, socializing, and celebrations often happen over drinks, and the struggle can be real. Through this podcast, we're changing that narrative. We're here to create a community where individuals like you, who choose not to drink or drink less, can find camaraderie, support, and practice.
Before we dive in, as leaders in the sober space, we pour so much into those that we serve, but who fills us up? That's why we're hosting Amplify Sober Voices, our Thought Leader Conference happening January 15th, 2026. It's where speakers and writers, podcasters, and changemakers are all coming together to reimagine what a truly inclusive alcohol-optional world can look like. Head to amplifysobervoices.com to learn more and grab your ticket. We'd love to see you there. Now, welcome to the Sober Life Rocks podcast, where we amplify sober voices from around the world. I'm your host, Margie Schaller, and every week we dive into powerful conversations with people living their sobriety out loud. My guest today is Stephanie Botts, a dental hygienist, educator, podcast host, and ergonomic specialist on a mission to support the health of both patients and providers. She's the founder of Posture Pros and a passionate advocate for prevention, not just in posture, but in overall health, including substance use disorder. Stephanie's latest work explores the vital role dental professionals can play in identifying and supporting people struggling with substance abuse, something she understands not just professionally, but personally. In this conversation, we'll explore what it looks like to integrate sobriety, health education, and care in unexpected ways, and how even the smallest moments of connection might just save a life. Stephanie, welcome to the program.
Thank you, Margie, for having me. Excited to be here.
Absolutely. So I just always love to kind of get to know my guests to start out with. So maybe just tell us a little bit about you and your story and kind of maybe the role that alcohol played in your life.
Sure. So, was first exposed to alcohol like many of us when I was younger. I was in high school, and I experimented here and there. It wasn't, I wasn't obsessed with it or anything back then, but I did my fair share amount of drinking while I was younger. But it really didn't become a problem for me until I was in my 30s. And it really started out as a habit, as it often does. I was, trying to take the edge off. Maybe I had a stressful day and I would have a drink here and there, but that quickly and quicker than I cared for it to turned into a daily habit. And, that tolerance built up for me. And so it took more and more of that drink for me to get the result I wanted. But it really quickly got out of control and turned into very dysfunctional drinking pretty quickly. And that lasted a handful of years. And I was, in complete denial. I thought I had full control over it. Alcohol's tricky in our culture because it is very normalized. And I thought that I still was going to work every day. I had a house. I was married at the time. I had money. I had a nice car. So I had all of the things, right, that society tells us we need. And so I thought I was okay because I had all those things. I hadn't gotten arrested yet. I hadn't lost anything. But I was losing something, I was losing myself, which is probably the most important thing to lose. But then I got to a point where, and I won't go into specifics, but it was definitely causing distress for myself and my partner at the time. And I got to a point where I was like, Stephanie, and it was a very personal thing, but I was like, if you continue doing this, you will go off the rails and you will experience some consequences at some point. So you can either go that way or you can try this other way. And thank goodness I was brave enough to try the other way. So that was in 2018, December of 2018 is when I got sober, and I've been sober ever since.
Well, congratulations. What
Thanks.
a great choice that you made. Now, at the time that all this was going on, were you still practicing as a dental hygienist?
Oh yeah. Yeah. The tricky thing is I was really able to kind of compartmentalize what was happening. And I was very close to the people I worked with. I was at this office for almost a decade. They had no idea what was going on because I still came in and was performing at a high level. I even went back to school and got another degree. And I was just able to kind of separate that. But that's the trick, right? Is we never know what's going on with someone. And that's why I think it's so important to talk about this, because nobody, even my close family members, had no idea how bad it was, because I got really good at masking it and pretending that everything was okay.
Mm-hmm. And not to mention, I mean, all of the ways that we gather are centered around alcohol. So when we're drinking what looks like socially with people, they don't question that.
Yeah. And what I've experienced is they question more when you don't drink. That's when the questions come in. That's it. That's kind of the flip with our society.
It's so crazy. And I definitely want to get into that a little bit. But tell me, when you first made this decision to stop drinking, did you share it with people at the time?
Besides my partner, I not at first, just because I was scared. I had no idea what to expect. But actually, my boss at the time at this practice, he was also in recovery. And it's so, I don't know if ironic is the right word, but he was very open in his recovery. We had a huge patient base that was in recovery as well. And so that was a conversation I was almost hearing every day at the same time that I was struggling. Like, that's how strong the denial was, is like, oh, these guys had an issue, but I'm fine. But like, I wasn't fine. So I ended up opening up to my boss, and he was so supportive. I mean, looking back, he was 100% instrumental in me, especially those first, 3 to 6 months, for me getting sober.
Wow. That's such a blessing. So tell me a little bit what it was like for you, though, navigating these similar social interactions, whether they were work related or I know you're a speaker. So as you go out to conferences, like, what is that like for you? What was it like at first, and what's it like now?
Well, so back when I was getting sober, I was a full-time clinical hygienist. That was my job. I didn't have a business. I wasn't traveling to speak, any of that. I'm curious how that would have gone for me back then, because these events, alcohol is a central part of these events. And I don't know if that would have been good for me at first, but now when I travel, I understand it. It's part of our culture. It's part of our society. I would love to see more sober, sober supportive events, I guess, with mocktails. I mean, don't discount mocktails. Those are actually really fun and give you something to hang on to and whatever. Sometimes it's just awkward when you don't know what to do with your hands if you're not like holding a drink,
100%.
But what I do, at first, when I first started speaking, I was not open about my sobriety. I didn't talk about it. I would usually get some kind of drink at a party to make it look like I was drinking, because I didn't want the questions. It's interesting how many people will ask you why you're not drinking when you're openly not drinking. So, but I understand it's part of it. And usually for me, if it's like an after party or something like that, I'll stay for a little while. But usually I know when it's time to go. And then I just, pull an Irish exit or I just say goodnight. So.
Mm-hmm, mm-hmm. So, and have you gotten questions from people?
Yes. Yeah, it's less now. And I just wonder if that's because of this movement of people being sober curious or wanting to stop drinking or realizing, that it's not good for you. But the first couple years when I was speaking, I would get asked almost every time, why are you not drinking? And that was always a tough thing for me I didn't know how to respond to that, I guess. Cause I'm like, do I just lay it on them and let them know, or just, kind of push it off? I know at first I would be like, oh, I'm speaking early in the morning. I just don't want to. But now, I have no problem telling people why, but I don't get asked as much anymore now, which is interesting. So.
Mm-hmm. And so what would you say today?
Oh, I would say usually I would joke. I tend to put humor on things, especially that make me uncomfortable. So I would just joke around and be like, me and alcohol, we don't have a great relationship. It's just better for me to stay away, that kind of thing. But it's been really interesting when I say that, or I'll just tell people, be like, I'm sober, I'm good.
Mm-hmm.
But that has opened up so many conversations with people, either that at that event, or I've been reached out to after with people who want to talk about it. So with that kind of positive reinforcement has made me more comfortable and just, letting people know. And I talk about it more in my lectures and on social media too.
So that's kind of what I want to get into now, is about your lectures, because the idea of, you specialize in ergonomics, which,
Mm-hmm.
for anybody who doesn't know, give us the elevator pitch what that means.
Ergonomics in dentistry, for as many of us know, and dental, even in this, it counts for front desk too, office workers also. But dental clinicians, office workers have some of the highest pain rates and disability rates of any profession. And it's because we're stuck in these really static, awkward positions for hours a day. And ergonomics is something that's something I struggled with. And I felt, I had an injury. I dealt with the consequences of not having ergonomics. And so that kind of ignited my passion to create my company and help people. So if we don't have ergonomics in dentistry, we're in trouble. So I'm really just trying to spread awareness about that. But there's a connection between self-medicating, right? Whether it's mental pain or physical pain with substances like alcohol. And so there's definitely a connection there.
Yeah, so that was where I was about to go with that. Is like, it seems like such a disconnect, but actually not at all, because
Yeah.
it's the easiest thing we can reach for
Yeah.
to seemingly make us feel better.
Yeah. And it's interesting because it does make us feel better at first, but the science shows, like, sure, you'll get that little bump of, like, euphoria or pain reduction or whatever. But if we look at long term, it's actually messing with our nervous system in such a way that it makes those issues worse. It makes our depression worse, anxiety, pain, all of that just gets worse. So it's a very temporary and tempting fix for something.
So that's an area I'd really love to dig in with you a little bit more. So tell me more about what exactly that means, that it actually is worse for us longer term.
We've got areas in our nervous system and in our brain that produce, like, natural opioids, for example. Those are endogenous within us, and that's our natural, like, pain killing system. And it's there. It helps us, whatever. But when we're using substances, whether it's alcohol or even cannabis or pain medications, whatever it is, it dampens our own body's ability to fight that pain. And so our body's like, well, we've got this substance now that's doing the pain killing for us. We don't need to work as hard. So it's almost like our body gets lazy and stops producing those natural painkillers. And then we become reliant on that substance to kill our pain for us, whether it's emotional or physical. And so that's the problem when people try to stop. All of those issues really just start coming back almost worse than they were before, because our body needs to get used to, like, producing those painkillers again. So it really, it's just kind of confusing how it works. And like, yes, it does work for a little bit, but then eventually it doesn't work anymore. And we have to get back to our body doing that for us.
So how how do we know the difference between coming home from a long day, just wanting to unwind and having a glass of something versus overdoing it and reaching into that place where we're overriding our body's natural functions?
I always encourage people to, because, substance use disorder, whatever it is, alcohol, cannabis, anything else, it looks different for everyone. And everyone's got their different limits on like what they can handle and what they can't. I always encourage people to just ask themselves, when you come home from work and you want that glass of wine, why is that? Is it because you had a hard day? Is it because your neck hurts? Is it because you want to escape maybe some feelings of stress? If that's the case, maybe that's not the best thing to use it for, But it's interesting with alcohol too, especially after work. It's like that glass of wine or the drink or the beer, whatever it is, it almost signifies the end of our workday and the start of our relaxation time. It's like this transition point. And it's interesting now, I used to do that every night. But now I was thinking about this last night. I have this like magnesium drink that I make at night. I mean, this is how boring I've gotten, Margie. I'm like, this is my transition point. Like, this is my glass of wine is this magnesium drink. Like it helps me calm down. It helps me unwind. And it's not alcohol, but it kind of is doing the same thing that alcohol used to do for me. So I just encourage
And I wouldn't
people,
call that boring.
well,
I would call that self-care.
Yeah. Well, thank you. Yes. Thank you for the validation. So I just encourage people to ask themselves that question, but also when it gets into like this red area of maybe someone's developing a problem is if it's a predictable pattern that you're doing it all the time, do you think about it during the day? Are you like, okay, how much alcohol do I have at home? Do I have enough? Do I need to stop at the store? And then you start craving it during the day. Maybe you have wanted to cut down and then you realize you can't, because your body needs that substance. And are you reliant on it? Like that's a really scary point to get to, is you think you have control and then you try to not do it. And then you realize you actually can't, either physically or mentally. So.
It was really, really good pointers. I remember even I got sober when my kids were sort of early elementary school. And I remember in high school saying to them, like, it's okay with me if you drink as long as we talk about it.
Mm-hmm.
Obviously, I'm not advocating for it, but I understand, and I just don't want you hiding it from me. But I said, it's all about why. Why are you drinking?
Yeah.
And what is it that is driving that decision point? Is it like, oh my God, I'm so mad at so and so, I'm going to get plastered, right? I said, that's a danger area.
Yeah.
And I think that's true through adulthood as well, as like understanding what those motives are, because our amygdala has an amazing ability to connect the dots to say, when I'm stressed, this is the solution. And it overrides our thinking ability, and it takes over. We no longer have the choice of being able to say, oh, maybe there's something else I could do, because that amygdala overrides everything.
Yeah. It's such a good point. And two, it's like alcohol or any kind of substance is tied to this idea of escape. It's like, oh, I'm just going to have this drink and that's going to make everything better. That shit's still going to be with you tomorrow. Like that person that you're upset with, they're still going to be there. That issue that you've got, the work problem, whatever, it's still going to be there. So it's not actually fixing anything. And the same way that alcohol messes with our nervous system for pain, it does the same for anxiety. We have these natural chemicals and processes in our brain that helps us deal with anxiety. And when we introduce substances, we don't have that anymore. So it's like, that's our coping mechanism, if you want to call it that. And then, that's why people wake up the next day with a hangover or with this crushing anxiety. And it's because of the way that alcohol really messes with the nervous system.
So, Stephanie, one of the things I also wanted to talk about was a lot of times, I mean, what a blessing you had a boss that was in recovery and supportive. But a lot of times, I think people are worried about the judgment and stigma. And I would imagine that it's even tenfold when you're in a healthcare provider position.
Mm-hmm.
So, I'd just love for you to kind of touch on the conversation that's had amongst people in this field and what it's like to navigate that as a person in recovery.
Looking back, if I didn't have my boss to talk to, I I would like to think that I'm pretty resourceful and looking up maybe support groups for people in healthcare. I'm in Denver, Colorado, and I know of at least one here that is a support group for people in healthcare that are struggling. So I would like to think that I would be resourceful enough to look that up, maybe look at my state. I think most states, if not all, have a peer assistance program where you can call and, talk to someone completely confidential. It's interesting in healthcare is like, we're so scared to talk about this because of our license or stigma or whatever it is. And yet we've got even higher rates of substance use disorder than the general population. So it's like, it's even more important for us to talk about it. And I really like seeing what I see on social media is more people coming out saying that they're sober, talking about it, and just establishing these networks for people to reach out to.
1,000%. I think it's the craziest thing ever that we're not judged when we are abusing substances or alcohol the same way as we are when we come out and declare that we are no longer using them.
Yeah. Yeah. I know. It's interesting, isn't it?
It's crazy. But you're right. I think every state now has some sort of resource that people can call into. And oftentimes, even what they can do is point you to a local meeting or a local community or a local group. But the other thing that I think that is so fantastic is that really since the pandemic, there's been this proliferation of people who are sober coaches so that
Mm.
you can, in the privacy of your own home, do things online, do things virtually, join virtual communities so that it doesn't have to be that feeling of risking going to a church basement somewhere and being seen by a patient.
Yeah. Yeah. No, that's a great point. I do think, I guess it depends on where people are. In their substance use and how dependent they were on it and how big of a role
Mhm.
it played in their life. But I think people have this false belief that once you stop using the substance, your life will get better just like that. It doesn't. At least for me, I got crazier because I didn't have my tool, my thing that was helping me cope with life, and I was using it to escape. I wasn't dealing with my issues that I had, either stuff that happened in the past or currently. So I didn't have the coping skills, right, to deal with life, and so I didn't have that substance anymore. And I was like, I felt like a 13-year-old girl trying to deal with life. I did not have the skills that I needed. So it's so important to reach out and get support, especially in those first few months or first year or two, because you are going to feel crazy. I hate to use that word, but that's what comes to mind. And so you need support in some way, whether it's a coach or a support group or a doctor or a friend, like whatever it is.
Couldn't agree more. I exactly relate to that. I remember thinking to myself, I don't even know how to name my emotions or name
Yeah.
what is going on because I just had numbed it for so long.
Yeah. Yeah.
And
And it
then
just it hits you in
we're
the
like,
face.
yeah, crazy. Stephanie, something else I wanted to check in with you about is this. A lot of times we know somebody who is struggling. We can
Hmm.
see, we can tell
Hmm.
that somebody is drinking too much or strung out on something, and it's awkward. It's like, what do I say? Do I say anything? Is it leading my business? And as a hygienist, I mean, you guys are like frontline dealing with people, spending an hour with them. You can smell the alcohol on them. I'm sure you can tell from their teeth whether or not they've been abusing certain substances. What do you recommend? How do you deal with that?
Yeah, that's a great question. I have actually established a little, I guess you could call it a system. It's just something that has worked for me for broaching this topic with patients. And I broach it whether I think they have an issue or not, because, like I said, so many times we can't tell if someone's having a problem. I use the oral cancer screening as leverage when I'm starting to talk to my patients about this. I've already looked at their health history. I think all health histories really need these questions on there about substance use, like alcohol, cannabis, any other kind of drug, tobacco, vaping, whatever. So I already have that in my head. And then I do the oral cancer screening. And I say, Mr. So and so, I'm going to do the oral cancer screening. Several substances increase your risk, including tobacco, alcohol, and cannabis. Do you use any of those? I ask that question to every single patient. It never changes. And so that's just a good, for me, it's a very non-invasive way to ask about their substance use. And it's also letting them know why I'm asking, because I'm looking for cancer. They are motivated to tell you the truth because they also want you to make sure they don't have cancer, you know? So that's been a really good way for me to just open up the conversation with patients. And I encourage people to really start asking, because patients 9 out of 10 have no idea that alcohol is one of the leading causes of oral cancer. They understand tobacco, but they have no idea with alcohol. So it's like, I'm not trying to get every patient that I see to quit drinking. I just want them to have the knowledge so that they can make an informed decision. Maybe when they go home tonight, they're going to have just one glass of wine instead of 2 or 3, you know?
Okay, so I'm just going to say, like, if you asked me that question back in the day, like, I would have way underplayed how much I drank because I didn't want you finding out. I mean, do you find that people are answering with
I
more
find
honesty?
that I find that people are honest. Maybe they're tricking me, but I find that they're pretty honest. However, usually whatever answer they give me, I'm still going to be educating them. So if they say, "Oh, I don't drink at all," maybe that's true. And I acknowledge that too. I think it's really important to acknowledge when people abstain from substances, because in our culture, it's not that easy. So I'll recognize that and be like, oh my gosh, like you're making such a great choice for yourself. Like that's awesome. It causes so many oral problems and physical problems, even at lower levels that people are drinking, like it could be harming them. So I kind of give them a little bit of education anyway. And that might open up the conversation for more, or it might just plant a little seed in their head. You know, it's like we think that patients, maybe we're not getting through to them. I get this with flossing all the time. It's like, are they hearing me? I don't know. They are listening to us. And it's like, we never know when that little seed is going to turn into something bigger for them later. So even no matter what answer they give me, I try to just throw a little bit of education at them too.
And have you ever had the situation where somebody kind of admits that maybe it's too much for them?
Especially after COVID. Yeah, because people had developed a habit of drinking just like I did. That's how mine started too. And then they, had this habit. Maybe they were drinking every day, whereas they were working. And when they were working, they weren't doing that. So when they go back to work, they're like, oh my God, I have this like habit where I have to drink every night now. So I had a lot of conversations after COVID, and every now and then, it doesn't happen that often, but every now and then a patient will be like, oh my gosh, I know that I'm drinking too much,
How do you
and
deal
like
with
I
that?
want, when they tell me that,
Mhm.
I just ask them like, how is it just a habit that you want to stop, or is it negatively impacting your life? Like, is it causing a problem with I always ask them if it's okay if I talk about this first, but be like, is it causing a problem with you at work? Or do you think about it all the time? Or are you having problems in your relationships? And I'm very open. When patients are open with me, I become very open with them with my experience. And I think because of that, it provides like a safe space for them to just open up and talk about it. So.
Mhm. What I find so beautiful about this is, we talk about amplifying sober voices and we talk about that we want to normalize it so that people feel safe and don't have judgment. And that doesn't always have to be from the rooftop. It doesn't have to
Mm-hmm.
be on TikTok. It doesn't have to be on stage or a podcast. Although those things are fantastic because we reach more people, it can just be one person talking to another person. It can just be a conversation from a dental hygienist to a patient, or it can just be one coworker to another coworker, because that's how we normalize things. And
Well,
I
and
feel like
we're all human. We're all living this life and we have this shared experience of being human, and it's not always perfect, and we are going to slip and
it's
fall and
messy.
make mistakes. Yeah, and it's like that's okay. We don't have to have these curated like Instagram pages where everything is perfect. It's like life gets messy and shit happens, and I just really want to provide people just a safe space to talk about it, whether that's me with a patient in the chair or me up on stage or talking in a social media post. But I mean, wouldn't it be amazing if we just planted these small seeds with our patients, just one-on-one with them? It's establishing trust, it's building rapport. And wouldn't it be amazing if 5 years from now, they realized that they had a problem with something and they remembered that 10-second conversation that we had with them? That's life-changing. And we have that
Yeah.
power in healthcare.
Yeah. A minute ago, you talked about that when you first got sober and suddenly realized you didn't have any coping skills. I would love to know from you, what could you pass along that's been a coping skill or a thriving skill that you have put back into your life in the years since you've gotten sober?
Sure. And I will say too, for my experience, getting sober was like step one of my, I don't know, mental health journey and maturity. I also got a lot of therapy, and I think that for some people can be very useful. I did EMDR therapy for
Mm-hmm.
trauma, changed my life, but I wouldn't have been able to do that had I not gotten sober. So I needed to. But I think something that helps me to this day is remembering that pretty much everything is temporary, including the drama that we maybe have that day, or the thought that we're having, or the problem that we're having. Like, is this actually going to bother me in a week or two or a month? Probably not. And even feelings too, they come and go so quickly, and yet we get so attached to them and think that is actually happening when a lot of times it's not. So just remembering that things are temporary, this too shall pass. I almost want to get that
Mm-hmm.
tattooed on me somewhere so that I remember it. But that has saved me so many times over the years.
That's amazing. I love that so much. Yeah, my my mantra has become that I have a 24-hour reset button.
Mm.
And if something is coming at me a million miles an hour and I don't know how to react, or I want to react poorly, I literally give myself 24 hours,
Mm.
because tomorrow, with a fresh set of eyes, I may still be flummoxed or pissed or who knows what, but I don't have the same intensity of emotion and I can think about it better.
Oh yeah, that pause. That pause is crucial. I mean, whenever you want to fire off that angry text or angry email or whatever it is, just like give it a minute or a day or 24 hours, like you said, because the next day you're probably not going to respond that way. And I
Yeah.
can, especially on social media, you can tell the reactive responses on there. It's like, oh, this person maybe should have waited a little bit before posting that.
1,000%.
Yeah.
Stephanie, is there anything else that you would like to share or that I haven't asked you?
I just think that in healthcare, we've got a tough job, physically, emotionally. A lot of us are very empathetic, and we tend to take our patients, medical conditions or even their problems onto ourselves. And it's very easy to turn to a substance to either numb out or help you cope with it. But, there is a better way. And it all starts with us talking, like what we're doing on this podcast or what you see on social media or lectures, whatever. It all starts with talking about it and normalizing that we're all human And most of us are affected by substance use, either directly or indirectly. And it is 100% okay to talk about it. And life is so much better on the other side. Sorry, I always get choked up. It's so much better on the other side.
Yes. And thank you. And being
You're
choked
welcome.
up is beautiful. Beautiful.
Well, it's just I just want more people. I know that there's people listening that are struggling right now and they don't know what to do and they don't know who to turn to. I'm here, you're here, Sober Life Rocks is here, other healthcare professionals, and we want to help you. And honestly, if I could do it, anyone can do it. And life just opens up and you thrive on the other side. So I just encourage people to be brave, take that step, because your life only goes up from there.
Amen. And I just want to say that while we're all about amplifying sober voices, it was so powerful when you said in the beginning that wasn't something that you felt comfortable doing. And I think that's really important, is that we feel safe. That first and foremost, we put the oxygen mask on ourselves. And then we take care of ourselves and we get ourselves stabilized and we get ourselves feeling healthy and whole again. And then, like Stephanie did, take that step, speak out in the world, let people know what beautiful recovery looks like, and feel free to amplify your voice for the next person down the path.
And it is so, I have gotten so much joy and it's just rewarding to hear from people, whether it be in person or on an email or whatever, and just hear their story and know that you at least reached one person, and it's like that has actually reinforced me being more and more and more open. If I didn't have that, if I didn't have people reaching out to me, wanting to talk about this, I might still be in the closet. I don't know, but it's very rewarding to share.
Yeah. Well, Stephanie, thank you so much for coming on and being so open and being so authentic about all of this. It just reminds me that every voice needs to be heard, whether you're a healthcare provider or somebody in recovery, or simply just curious about your own path. We hope that something meaningful was sparked in you today. Before you go, here's how you can help us keep these conversations going. Subscribe, share, and please leave a review. It helps more people find us, and it lets these sober stories rise to the top of these algorithms. And if today's episode fired you up, then please join us at Amplify Sober Voices, our Thought Leader Conference happening January 15th, 2026, where leaders come to get filled up and shape an alcohol world that we all want to live in. Go to amplifysobervoices.com. Until next time, stay proud, stay present, and keep showing up in your sober life. Thank you, Stephanie.
Thank you.